we'll just get right into it. And we'll probably start off with the most common question that most people are faced with at some time or another throughout the year, and this happens with everyone. And that's whether or not you're dealing with allergy symptoms or you're dealing with cold symptoms. It's a very common question. I get it all the time. And it turns out that a lot of the symptoms cross over, and this is a big deal. So we're going to go through this distinction really quickly here. So basically, a cold typically has a very common sequence. You get infected, you have congestion, then runny nose, some drainage in the back of the throat. For some people, it's sore. For some people, they get a little fever with that. And then you get a dry cough. And then that cough goes into a productive or mucus rattle type of cough, lasting about 8 to 10 days. Then you're left with that cough going into the following week. That's a classic cold. Let's break these symptoms down. So a cough, oops, sorry about that, guys. There we go. A cough is, again, usually present. Typically, if you have an allergy, sometimes it's there. Aches and pains are almost never allergy related. So typically, if you're feeling really, really run down, sometimes fatigue, you can have that seen in both situations. Itchy eyes, if your eyes are itchy, that's more allergy related. That's not having a cold right there. Sneezing, runny nose, and congestion is both seen in a cold and allergies. A sore throat more often goes with colds as opposed to an allergy. And again, if you have fever, feeling like you have some chills, that's you being sick. That's not you having allergy problems. So what makes that distinction more so than anything else is how long it takes. Typically, if you get to the 14-day mark and you're feeling worse, you probably need to go and see your doctor because you may be dealing with a sinus infection. But if you get to that 14-day mark and just have a regular cough and you're getting much better, that likely was a cold. But past that point, certain times of year, or say you have symptoms between September and October, or early spring when pollen is landing on cars, that's probably looking more like allergy type of symptoms. So say you have allergies. Now what do? You think you have these runny nose congestion symptoms. They're nagging you all the time. You got this post-nasal drip going. What are you going to do? You go to the store and you pick up an over-the-counter medication. This is very common. Everyone does it. Rite Aid, Walgreens, Walmart, wherever. And you pick up a very typical medicine. Start off with Claritin. And I'm going to focus on a few things here, particularly the actual generic name, like Loratadine. And you need to know these names because Claritin, again, that's the name brand. Loratadine, which will be the store name brand or the generic, often several dollars cheaper, and sometimes you can get more bang for your buck when you buy it in bulk sometimes. Another one, or the competing product, Zyrtec. Everyone's seen these commercials. Zyrtec's a little stronger than Claritin, a little bit more powerful, works a little faster, but again, at the end of the day, does the same thing, relieves runny nose, congestion, and sneezing for a lot of people. Cetirizine is the name of that product. So you'll go to the store, you'll see Zyrtec, and you'll see Walgreens version or Rite Aid's version of Zyrtec. Flip to the back, and it'll say Cetirizine. Remember those names because, again, they could be mixed in certain other products, and that can spell doom for some people. You always want to choose the one with the less side effects. Zyrtec, by the way, is a 10 milligram product. 10% of people get sleepy when they take Zyrtec. So again, I tell people to take these medications once a day, preferably in the evening when you're done at the day of, or you're getting ready to go to sleep. Claritin, and don't be fooled by this product here when it says 24 hours. Both of them work 24 hours. They're once a day medications. And so they will both essentially do the same thing. So Claritin is a good place to start, or the generic version of Claritin, also known as Loratadine. Zyrtec's even more powerful, works a little faster, a little bit more potent. Both of them work in 24 hours. Now, Zyrtec and Claritin both have a D component. We're going to get into that D component fairly soon. See, that D means a decongestant. Both of these products have it. And that means that there's a 12-hour version of what we call Sudafed in it. And you're going to have to watch out for that because we're going to talk about the side effects in a bit. But what I'm going to say is the difference here is that they only last 12 hours. 12 hours. Meaning you have to take one in the morning and one at night. And it only has half as much medicine as the previous product. Meaning Zyrtec by itself is a 10 milligram product. Zyrtec D is a 5 milligram product, so you're automatically underdosing. So you have to take that second dose if you really want significant relief. Same thing with Claritin. Claritin is a 10 milligram product. You get that Claritin D, It's now a 5 milligram product in the morning, 5 milligram product in the evening combined with Sudafed. I want to spend a little time about alternative medicines. Most people, when they're suffering from allergies, have either thought about it or have taken some product that they believe is natural, complementary, or alternative, and they really want to know where they stand with these types of things. Do they really work? What's the big deal? Because everyone wants to go green and be more natural these types of days. Well, turns out there's only a few products that actually have some reliable evidence that works. And I'm only going to show you some products that people have actually done some studies and shown that it works. Typically, when you look at Claritin and Zyrtec, you looked at many people, and they want to know, and the FDA was set up for our safety. Before they put a product out there, they want to make sure that that product is safe and it works. A lot of these alternative medications or alternative products have not undergone that same level of diligence. So beware of that. Let's start off with vitamin C. Vitamin C is in everything, almost everything. It has some weak antihistamine effects, so generally having vitamin C in a multivitamin or in your foods, it's a good idea. People with low vitamin C, they tend to have higher histamine level. Histamine is that chemical in your body which leads to runny nose, congestion, and sneezing. Now there's some evidence that says that it helps, a lot of evidence that says that it does not help. So I don't usually recommend it for allergy sufferers, but again, a good multivitamin, drinking a glass of juice, eating an orange, vitamin C has other effects that's generally good for your body. Grape seed extract. They market this as the natural antihistamine. Don't be fooled though. It does have some antioxidant properties and it might block some histamine release, but put it to the test, it has not been shown to work for allergic nasal symptoms. So some people will swear by this product, others will say it doesn't work. I can tell you the overwhelming majority of people who use it, it's like water. Quercetin. This is another product. It's found naturally in fruits, vegetables, certain wines, certain herbs, mild anti-inflammatory effects, and it has been shown to block histamine. But there is no reliable evidence for this product either that it helps with allergic nasal symptoms. Again, these are the most common, rigorously tested products, alternative products for nasal symptoms. Stinging nettle. A lot of people haven't heard of it, but you go to some whole food places, they'll tell you about it. Contains vitamin C, K, keratin, quercetin, potassium, and calcium. So it has a lot of good things in it, actually. And it does modestly reduce some of the symptoms of allergic nasal symptoms. So there are some people out there who are a little skeptical about certain medications like Claritin and Zyrtec. It's medicine. I don't want to put these things in my body. Is there anything natural I can try? Stinging nettle is an option. It's not to be relied on for optimal relief. So basically, it won't work as good as Claritin or Zyrtec will, but at the same time, it has helped some people. So it is something that people can go to, but it's not something I typically recommend. Butterbur is another product. It's the best studied natural product. It has to have 8 milligrams of potassium in it. So you have to actually look at the back and see that it has 8 milligrams for it to actually work like you want it to work. You want it to relieve that runny nose, that congestion, and that sneezing. It has to have that in that product. And you want to make sure that it's UPA free because that product is a carcinogen. Not all of them will say UPA free. If it doesn't say that, don't touch it. But if you're allergic to ragweed, which a lot of people are in this part of the country, and you wouldn't know that unless you're allergy tested, it may make your symptoms worse. So if you actually take that product and you're more congested, more stuffy, more runny, it's because you're probably allergic to something else. You need to leave this medicine alone. Echinacea. Everyone's heard of this. It's in the stores. Bottom line is it doesn't work for colds. It doesn't work for allergy symptoms. Leave that product on the shelf. That's what it's marketed for. But it doesn't work. Meaning you can give 10 people with allergy sufferers that product and give 10 people water. They'll have the same symptoms. No change. But there will always be at least 1 or 2 people who will say, you know what, I actually feel better. And that's called the placebo effect. And it's the real deal. People will swear by it. And I've had to talk some person out of it and say, you know what, echinacea works every time. I'm not going to argue with anybody. If you feel like it works, at the end of the day you feel better, that's fine by me. I can just tell you that most people, it will not. Oh, and by the way, it cross-reacts with ragweed as well. And so if you're allergic to ragweed, it can make your symptoms worse as well. So the meat of the talk is going to focus on common cold management and other sinus issues. So you got to start off with prevention, and that's a big deal. Not everyone's conscious about washing their hands or using hand sanitizer, but I advise you to do so. A lot of people pick up cold and flu viruses at supermarkets. You know, the baskets will be there, and you push it. People are coughing and sneezing, and they're pushing those baskets all the time. Very common source of infection right there. Number two, they'll go to restaurants. They never wash those menus, by the way. So you'll sit down there, you get your menu, hold it, look at it, which is fine, hand it back to the person, get up and wash your hands, or take out your hand sanitizer. People cough and sneeze and rub their nose on those things all the time. They'll clean that table, but they will not clean those menus. Think about that. So when you get infected, that's a big deal, I know. When you get infected, the best thing to do is have some rest. That's not always available for everyone. We're always working, having things, so not everyone has that luxury of getting some good rest. But I can tell you good hydration is a key right here, because when you get a cold, you're going to overproduce mucus. You're going to get really stuffy. It's going to pull water from your body. And so if you don't replace that water, you're going to feel dry, you're going to feel run down. So everyone can grab some extra water, or you don't have to give Gatorade or Powerade, just some water and drink a little bit more of it. Don't underestimate pain relievers, because you have aches and pains. Tylenol, Motrin, Aleve, these things help out. But we're going to spend some time on these over-the-counter medications to kind of break these things down here. Sudafed. This is a very common decongestant product. So typically when you have a cold, that biggest symptom that people complain about is that I'm stuffy, it keeps me up at night, I've got some referred pressure and pain right here, maybe it's going into my ears. Sudafed does help to relieve that to a certain extent. Now, there are over 10 different types of Sudafed. There's Sudafed that you have to get over the counter. You have to show your license with that and sign your name, because they use this product to make crystal methamphetamine. And you can only get one at a time, by the way. Sudafed PE is at the shelf, and you can pick that up wherever. And then there's a Sudafed 12-hour, which also is behind the counter. You have to sign your name for as well. And there are subtle differences. Basically, Sudafed contains pseudoephedrine, as does the 12-hour. This Sudafed by itself with these little red pills right here lasts 4 to 6 hours. I typically advise not to get that unless you want to take a pill every 4 to 6 hours. Sudafed 12 hours is where you want to go, because you take that once in the morning, take that once in the evening, and that covers you. Sudafed PE is kind of middle of the road. It lasts only 4 to 6 hours. It's not as strong as regular Sudafed, and it doesn't have as much side effect profile issues with it. The active ingredient in Sudafed is, like I said, pseudoephedrine. That's the one you want to go with. Phenylephrine, less so. Again, it lasts more than 4 to 6 hours. The Sudafed, the 12-hour version, 8 to 12 hours. Both of these products, and this is the key here, can worsen high blood pressure. If you have anxiety, it can worsen that. If you have trouble sleeping at night, it will worsen that definitely, without a doubt. And it also can raise your risk of heart disease as well. So you don't want to be on these products for long periods, but during a cold, it's something that you can grab. But if you have these issues, you better watch out. Nasal decongestant products. These are the products that are over the counter that have gotten a reputation. If you use that nose spray, you might get addicted to it. How many people in here have heard that type of thing? They're talking about these products right here. Neosynephrine, which is essentially phenylephrine in a nose spray. Afrin, and now even other products like Mucinex. Everyone see that little Mucinex commercial. They have pills or liquid. Now Mucinex has gotten into the business of making nose sprays. Same medicine in this as an Afrin. And that medicine is Oxymetazoline. It's just a nasal decongestant. So I'm going to be honest with you. This product works well. Within 15 minutes, you do 2 sprays per nostril, you will be less stuffy. Lasts 4 to 8 hours, and it's typically taken twice a day. Here's the big deal about it. You take it more than 3 days, it could lead to dependency and habit formation. So we tell people to stop in 3 days. I'm going to be honest with you. When people need relief, they often do not stop this. I know people who take this medicine every day. You look inside their nose, looks like chewed up hamburger meat. Over time, it does the same thing that cocaine will do to your nose. Just destroy nasal tissue. It's a huge, huge deal, and we often have to give oral steroids to break people out of that type of thing. Because once you use it 5, 6 days in a row, say you use it that night, then you don't use it that morning, that following night, you're even more congested. And so what do? You take that medicine again, and now you're dependent upon it. That's how this product works. And by the way, just like those others, it can raise your blood pressure, and it can increase your heart attack and stroke risk. So watch out for this. Very effective, temporary relief, but it can come at a price if you go more than 3 days. This is one of my favorite products. It's non-medicine. Nasal sinus rinses. They're very effective at releasing nasal congestion and mucus buildup. I highly recommend this when you get a cold. I just tell people to buy these and keep them, and just buy some refills. Essentially, you can do it once or twice a day when you have a cold or allergy-based symptom, so it works for both. It's very effective. It comes as sprays on actual rinse bottles. Now, the rinse bottles are going to work a little bit better. Basically, I'll give you some ideas of what they look like right here. This is one brand. I don't endorse one brand over the other, just that they had better pictures here. So here's the sinus rinse. Here's the bottle. You fill it up with lukewarm water up to a fill line right here. And you put this little mix in there, and you put your thumb over it and just shake it up. It really is that simple. You get over the sink, and you spray it in one side of the nostril like this. It comes out the other side. Spray it in, comes out the other side. Sounds a little nasty. Trust me. But at the same time, you do this product twice a day, you get over a cold, you get over a sinus infection, you get over your allergy symptoms quicker with this medicine. Excuse me, not even a medicine, with this product. So do not underestimate it. It is something that actually works. Some people like the squeeze bottle. Some people like the little angle action of the neti pot. And so it's a good stuff. But I can tell you this, don't use hot water thinking that that's going to clean your sinuses out better. That will give you a headache. And do not use cold water either. Just regular room temperature water, and you'll do just fine with it. So, sore throat. Everyone's had it in this room. So how do you manage it? Start off with rest. Again, that's a given. Adequate fluid intake. We talked about hydration. But basically, a sore throat is secondary to drainage in the back of your throat. It causes irritation in the back there. So gargling with salt water, people have said this all the time. Does that really work? Well, it helps out. It breaks up some of that mucus, and so you can get over that sore throat quicker. But you can do what most people do, and this is what they do. They try to cover the symptoms. What do I mean by that? They take cough drops or sore throat drops with menthol, like Halls and things like that. Let me tell you what Halls does with menthol. Menthol is a naturally occurring product. It makes your nerves in the back of your throat have a cool sensation. So it takes away that pain sensation and makes it feel cool. So now it feels cool, and now you just think that you're being treated. Nothing's happening there. It's just fooling your symptoms for about an hour, and then you need another drop. That's why they don't just sell one cough drop. They sell a whole bunch because you have to keep taking them, okay? Now, you can use local anesthetics, and this is a different product. This is Sucrets. They actually work a little bit better than the menthol ones, and they last a little bit longer. So it just basically deadens the tissue back there so you don't feel it. Again, it does not treat sore throat. Covers the symptoms. But again, that might get you through the night. That might get you through that presentation. So it is an option. So having something like that when you have a sore throat with a cold, I don't advise against it because for the most cases, it doesn't raise your blood pressure. It doesn't have any extra side effects. And again, it gives you some modest relief if you have to do a talk or something like what I'm doing now. Common cold and cough. I see cough all the time. Everyone's had it. Sometimes it's benign, sometimes it's something that we have to watch out for. But basically, when you have a cold, you got two approaches. You could treat the drainage that's most likely causing the cough, and that's the most effective option, without a doubt. Or you can attempt to suppress the cough, and that's often less effective. This is where people go with first most of the time. So we'll start off with that. So you can try those non-medicated lozenges, which contain honey, Halls, menthol, honey drops. Again, honey has been shown to coat the back, that cough sensor. You have like a little sensor in the back of our throat. When drainage hits it, causes us to cough, just like that. Honey kind of coats it, so when that drainage gets back there, you don't want to cough nearly as much. Your cough may not have the same intensity, might not keep you up at night, but again, you can't go to bed sucking cough drops. Lozenges with menthol, same effect as sore throats. Again, temporary relief, covering the symptoms, not that good in treating cough. Coracetin has cough medicine in it as well, so it's just like a pill that you can take, and it actually has dextromethorphan. So I want you to focus on this because dextromethorphan is in a lot of products. You see something that says DM or for cough and cold, it often has this product in it. And it's found in Robitussin or Delsum. Robitussin lasts 4 to 6 hours, Delsum 8 to 12 hours. So Delsum is automatically a much better product than Robitussin because it's longer lasting. So sometimes I'll tell people to take Delsum 2 teaspoons in the morning, 2 teaspoons in the evening. And again, it helps somewhat, helps bridge that gap, helps you get to sleep if you're coughing all night. It's going to work better than things like NyQuil and things like that, which people kind of drink very easily, and I can tell you it has very limited benefit. Now, it's often combined with other products, so Robitussin or Vicks brands. Look for these types of things because too much dextromethorphan can cause abdominal discomfort. It can make you feel very nauseated. It could impair you, especially if you operate machinery. So watch out for that product. Or you can focus on the drainage treatment attempts, which is what I tell people to focus on most. And that's the most effective way of reducing cough, without a doubt. So this is what you do. You dry that drainage with chlorpheniramine. Now, chlorpheniramine is in chlorotrimethoprim. Chlorotrimethoprim is one of the few products. I think there's at least one other product that has chlorpheniramine in it. I think Chloracetine has some of that as well. That and Benadryl are older generation antihistamines. They're usually a shorter acting. Diphenhydramine, remember that one, because that's in Benadryl. So something they'll say a sleep aid that has diphenhydramine in it. Tylenol PM, diphenhydramine in it, because that's the Benadryl component in it. It will make you sleepy. Only lasts 4 to 6 hours. So it's more potent and more drying for that drainage-related symptom, which leads to that cough. And so it's a better product for that type of thing if you can tolerate it. A lot of times when you combine it with a decongestant like Sudafed, really helps dry that up. So people will say, you know what, doc, I still have a cough, but your cough is not as intense. And remember, it's normal to have a cold and have cough. You've got that mucus is draining out of your sinuses. It has to go somewhere. It can't just sit in the back of your throat. It's normal to have that, but when it's impairing you, you're coughing and disrupting things, or you have to get up and walk out of rooms, or you can't go to sleep at night, this is some of the options that you can have. But remember, the side effects of Sudafed or pseudoephedrine. It can keep you up at night in some people. Again, Benadryl, chlorpheniramine, or chlorotrimethoprim can cause drowsiness. Do not take it if you have glaucoma or an enlarged prostate. Last but not least, if you don't have an ulcer, Naproxen is something that's overlooked. Basically, that's Aleve, 400, 500 milligram tablets, 3 times a day for about 4 or 5 days. Actually helps with inflammation, which contributes to cough, and knocks it out. Studies have shown this. Most people don't know this, but Naproxen helps really well with cough. I'm in the business, and I don't like to give narcotics for cough, products with codeine, things like that. I don't do that. And I see a lot of cough, and people will ask for it. We usually go through these same types of things. I may use some prescription strength medicines which contain some of these same products, but I focus on controlling the drainage, and that's what you really want to do to try and get the better of that cough when the cough is coming from right here. Typically when people come to see me, however, a lot of times that cough is coming from down here, either bronchitis, maybe asthma, or some other related symptom that we're not really talking about today, but again, most of the time, Naproxen will take care of it. So, combinations, I want you to be aware of this. Basically, many products will have multiple ingredients. Everyone wants to make a combo product so you can just buy one thing and that takes care of all the symptoms. Now, that can be an issue for some people. Do you really need Tylenol combined with cough and cold medicine? Well, again, like I said, Tylenol is pain reliever. You have aches and pains, you're cold, you feel rotten. What do you take? You can take Tylenol, but I always tell people if you feel like you're achy, buy some Tylenol. If you have some cough and cold symptoms, get medicine specifically designed for those symptoms. Don't get a combination product. Let me give you a case in point. Tylenol arthritis. I've seen a commercial for that. Say you have aches and pains. That product works. It's basically double strength Tylenol. So it actually has more Tylenol than just regular Tylenol. That's the only thing it has in it. And maybe a little extra dose of something like caffeine, which has some issues with it. But anyway, you're taking that 2 or 3 times a day. It relieves your pain. But now you got a cold. And so you pick up some Contact cold and flu brand, and you're taking it twice a day. And it's very effective. It's working well. Problem is, you're now receiving 2,000 milligrams of Tylenol a day, and that's not good on your liver. That's toxicity. So, because they both contain Tylenol. So the other name for Tylenol is acetaminophen. Flip that box, read the back, active ingredients, acetaminophen, 500 milligrams. If you're already taking that, you need to leave that product there. Leave it there. Vicks, Sudafed, Robitussin, you go to those shelves, you'll see a good 20 of them. They'll all have the same thing, and they all have combinations. So you want to focus on the generics as well. But when you look at the generics, they will have combinations too. So what do? Learn to read the active ingredients. Basically, Sudafed, that's for congestion. Pseudoephedrine. Same thing with phenylephrine. Chlorpheniramine, that's another one right there we talked about with drainage. It's an excellent product with drainage-related symptoms. So is diphenhydramine. The other name for that is Benadryl. It helps with drainage and drainage-related coughing. So looking at these products, that and dextromethorphan for things that say DM, these things will help out so you won't have to say, oh, do I need all these products? Figure out something that you need. Sudafed for the congestion, chlorpheniramine for drainage, diphenhydramine for the drainage, acetaminophen, which is Tylenol, for aches and pains. Have separate products in your home. Stay away from those combination products. And by the way, I do not like Alka-Seltz or cold and sinus. Again, it has combination medicines in it. And again, it just relieves symptoms very temporarily. So you want to focus on just individual products. It's not that we're trying to break the bank here, because I know everyone wants to save $1. But trust me, you will be less at risk for side effects when you know what you're taking and when you take a product that has one agent in it. And I think that is all. So when you are at the end of all of this and you still have symptoms, what do? Then you need to go and see your doctor. And if you think you have allergies, then you need to go and see an allergist. I'm going to stop right here and open up because I want to leave a lot of time for a question and answer session that we can talk about allergy and pollen when someone brings that question up.